Hi, my name is Grismel and this is the chapter 22. The heart and circulation 1. A. Shortness of breath. Shortness of breath or breathlessness is dyspnea. At first, this is caused by extension physical activities such as climbing stairs, but the severe case, it may be present even at first. A patient who is breathless when lying flat, orthoponia, for example, in bed, will tend to sleep raised up on two or more pilots. The abbreviation SOBOE stands for shortness of breath on exercise, or extension, or the effort. Patient says, I get terrible short of breath climb stairs. Doctors can ask, how many pilots do you sleep on? B. Heart rhythm. The normal resting heart rate is 65 to 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 minutes. The heart rhythm may be regular or irregular. In irregular rhythm, arrhythmia, there may be early beats which interrupt the regular rhythm, pressure beats, or the rhythm may vary with respiration, or it may be completely irregular as in fibrillation. When patients are aware of irregularity, they describe the symptom as palpitation. Case 4. A 22-year-old student was admitted to hospital with a long history of heart problems. She had been increasingly tired, with shortness of breath on exhaustion, orthoponia, and palpitations. A mitral valve replacement had been carried out 3 years previously, and this has stabilized the symptoms of heart failure, but was followed by episodic attack of atrial fibrillation, which had been particularly severe for the 6 months before admission. C. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute, for the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptoms is breathlessness. The symptoms of right heart failure include peripheral edema, swelling, beginning in the feet and ankles. This is known as a pitting Oedema if, when a finger is pushed into the swelling, it causes a small depression or pit. This is the image, a picture to a hair. So we have aorta, pulmonary artery, pulmonary veins, mitral valve, septum, and tricuspid valve. This is the exercise to chapter 22. 22.1. Complete the conversation based on a case study in B opposite. Doctor, what seems to be the problem? Patient, I've been getting palpitations. Doctor, how long have you had them? Patients, for about 6 months. But I've had a hair problem for years with the tiredness and shortness of breath. In the end, I could work more than 100 meters without having to stop. I had to sleep on 3 pillows. I had mitral valve replaced 3 years ago and improved things for a while. 22.2. Make word combination using a word from each box. 2 words can be used twice. Look at B and C opposite to help you. 8. At. Atrial, cardiac, heart, on, peering, premature, output, failure, oedema, fibrillation, beats, effort, rest. At rest. Premature beats. Peering, oedema, atrial fibrillation, heart failure, cardiac output, cardiac failure. 22.3. Write the words and a patient will use to describe the symptoms below. Look at A, B, C, and opposite to help you. 1. Dyspnea. A breathless, shortness of breath. Arrhythmia, palpitations. Orthoponia, a breathlessness when lying flat. 4. Oedema, swelling. 22.4. Complete the case report. Look at A, B, and C opposite to help you. Case 13. A 60 years old woman attends her GP's surgery complaining of breathlessness. Extraction it had been increasing over the previous 8 months until it was producing problems and around 500 meters walking on the level. There was a story of chest pain. She had several episodes to fast palpitation, which last 20 to 30 minutes, and were associated with some shortness of breath. She had not noticed some swelling of her ankles by the end of the day. This disappeared overnight.